Have you ever met someone who seemed completely charming on the surface, but had a total lack of empathy underneath? Someone who manipulates others without remorse? You might be wondering, are they a sociopath? And if so, does that mean they have a mental illness? Let's break it down. Sociopathy is often misunderstood. It's a term that gets thrown around a lot in movies and TV shows, usually portraying villains with no conscience. But what does it actually mean? And more importantly, is it considered a mental illness? Today, we're diving deep into the psychology behind sociopathy, how it's diagnosed and what it means for those who live with it. First, let's clarify what a sociopath is. The term isn't an official medical diagnosis. Instead, it falls under a condition known as Antisocial Personality Disorder in the DSM-5, which is the diagnostic manual used by mental health professionals. People with antisocial personality disorder show patterns of behavior that include disregard for the rights of others, manipulative and deceitful tendencies, a lack of remorse or guilt, impulsivity and aggression. One key question is, does this qualify as a mental illness? To answer that, we need to define what mental illness is. Mental illnesses typically cause significant distress and impairment in a person's daily life. However, many sociopaths don't feel distress in the same way others do. They might struggle with legal issues, relationships, or impulsive decisions, but they don't always see themselves as having a problem. So, where do mental health professionals stand on this? Antisocial personality disorder is recognized as a disorder in psychiatry, but it's different from conditions like depression or schizophrenia. Many mental illnesses cause suffering to the person who has them, but sociopathy primarily affects the people around them. This raises ethical and practical questions about treatment. Can sociopathy be treated? It's challenging. Traditional therapy relies on emotional insight and a desire to change, but sociopaths often don't see a need to change. Some therapies, like cognitive behavioral therapy, can help manage behaviors, but there is no known cure. Now, let's hear from you. Have you ever encountered someone who showed signs of sociopathy? Do you think it should be classified as a mental illness, or is it something else entirely? Drop your thoughts in the comments. Sociopathy is a complex topic, and there's still a lot to learn about it. But understanding the difference between personality disorders and other mental illnesses helps us have more informed discussions. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell so you never miss our deep dives into psychology. Thanks for watching and see you in the next one.